This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham, and I have got some return guests. Thank you very much for coming back. Ashley and Chandra Snar. You're both registered dietitians with the Rideau Community Health Services. March is Nutrition Month.
Yeah, thanks for having us.
Thank you very much. I think it's been a year since you've been here. It doesn't seem like that.
I know, it's gone by quickly.
I mean, nutrition is such it's near and dear to my heart, so we could talk forever, so you're going to have to cut me off.
Sounds good.
Now, you are certified diabetes educators as well, too, so let's talk a little bit about that. What does that entitle, having to be certified diabetes educator?
Yeah, so you have to have a certain amount of hours to be able to qualify to write the exam. So it is a specialty in kind of the health field. You have to be a dietitian or a registered nurse or pharmacist to be able to qualify to write the exam. So it just kind of means that we write this exam every 5 years. We keep up to date on all of the up and coming diabetes, the new things coming out.
Oh, there is so many new things coming out, medications and treatments, that sort of thing, all the time.
Yeah.
All the time. Now, you are both dietitians with Rideau Community Health Service. How long have you been there?
I've been there almost 8 years.
And you?
It'll be 7 years in July.
Okay, so what does your typical day look like supporting people?
It can vary day to day, but most days we're seeing people one-on-one, so we'll fill our day. We work actually as a team, so with a registered nurse, the dietitian are there together with the client, most appointments, although sometimes it's individually. And we see clients, we talk about their diet, we talk about their medications, we talk about their whole history, and kind of come up with a plan with them to see how we can improve their blood sugars.
Okay. Now, we're talking that March is Nutrition Month as well, too. You do more than just a diabetes training with people, or that's your specific specialty?
I mean, people don't just have diabetes, right? So because we are dietitians, if they have issues with cholesterol or hypertension, or maybe it's irritable bowel syndrome, we will assist them with that as well. And then we also have other community dietitians with Rideau Community Health Services that kind of do everything other than diabetes. But because we have them as our clients, we will see them and help them with their other issues as well.
Well, that's good to know too, because I mean, most often people think dietitians, I have to lose weight, I have to, get healthy, that sort of thing. But when we're talking, irritable bowel, we're talking diabetes, we're talking cholesterol, that sort of thing, that's when you can help people out as well too.
Yeah, there's a lot of knowledge and education that people don't, they don't know what they don't know.
Right.
So it's kind of up to us to help guide them and teach them.
And I mean, we were talking earlier too. I mean, I'm in my 60s, and the testings and things, pre-diabetes wasn't around when I was younger. Yeah. The blood work people can have now too, their A1Cs, you can find out what your blood sugars have been for 3 months. Cholesterol, that sort of thing too. People come in and they find out earlier, which is good.
Yeah, exactly.
And then they can come in and get some training or
teach. So those are all the kinds of things that we review in our appointments, and the goal is to help people early on now so that we prevent those complications of diabetes, so we can review their A1C, their cholesterol and everything, and find ways to help them to prevent what can happen, because, like I said, back in the day, they didn't have those tests, they didn't have the resources we have now.
And one thing, I worry about too is, like, as a parent, you want to be teaching your children how to eat properly too. So do you do things like a family or a group, that sort of thing, or?
Yeah, so Chandra and I don't typically end up doing stuff like that.
Okay.
It would be our other dietitians that work in the community, but they will see, children, parents. They'll do cooking groups with kids and try to promote that healthy eating at a young age for sure.
Now, one thing, basic nutrition, there's a question, is groceries are expensive. And people don't have access to healthy food as well, too. Like, would you be able to help people out with that, like with food banks?
It's a huge challenge. We definitely try to connect people with what resources we have in the community, and we also kind of coach them on what are the cheaper, nutritious options. So, and what you can get at the food bank that you can make as a nutritious, healthy meal. So, for example, frozen vegetables, canned vegetables, those are not just as nutritious as fresh. And usually you can get them on sale, you can store them longer, so finding strategies like that can help.
Okay. I keep bouncing all over the place. Go back to diabetes again. Now, do people come to you surprised that they just got diagnosed, or
It's a mixed bag.
yeah.
Some people know their father has it, their brother has it, and they figured, okay, I'm next in line. Everybody in my family has it. And then some people are completely shocked. Yeah.
Okay, and I mean that's a good thing too. What you were just mentioning about inheriting this. Do people come asking, my mom and dad have had it, my uncles had it? Do they come asking before they know they're diagnosed how to help themselves?
Some people will. Most of our referrals are from doctors actually who have made the diagnosis already, but
Right.
sometimes people refer themselves and they say, you know what, I'm at risk of diabetes. What can I do to prevent it? So
Absolutely.
we do have that sometimes, but more often it's somebody's already been diagnosed.
Okay, now there's a few locations for Rideau Community Health Services. Which ones do you work out of?
I'm mainly in the Brockville office, but I
Okay.
do travel around. So we have kind of remote satellite locations that we go into, different doctor's office like Prescott, Gananoque, Portland. I work in different places just to meet people closer to where they are, but
So
mostly
you will go to
Brockville.
them.
Yeah, exactly.
Excellent. And how
And then
about you?
I'm mostly Smiths Falls, Merrickville, Perth, Westport.
Okay. So do you have the opportunity to work together sometimes, or just
Not
once a
very
year when you come
often.
here?
Only stuff like this.
Excellent. So March is Nutrition Month. What would you like to get out there to make people aware of March being Nutrition Month? Maybe I'll start with you.
I think just, we are really fortunate in the Lanark, Leeds, Grenville area to have dietitians available free of charge. In greater cities and stuff, that's not often the case. People don't have access. So here we do have a lot of access. If you have any issue or you just want to eat healthier, you can self-refer to Rideau Community Health Services.
It doesn't have to be by a doctor.
It doesn't have to be by a doctor. Yeah, so just take advantage of our services because we're here and we're, really able to help, and we do know a lot about the services in the community to assist you. So.
And like some people, New Year's resolutions, I'm going to eat healthier, that
Yep.
sort of thing. When you
Yeah.
get the support, you're more successible.
Yeah.
It doesn't have to be New Year's either. But anytime, it's
Exactly.
like I gotta get
Yeah.
on the bandwagon here. So yeah. And what would you like people to know?
I guess the theme this year is we are dietitians. So understanding what a dietitian is. So we are registered, we're regulated, we are the specialists that translate the science into nutrition recommendations, and we work with people to come up with a nutrition plan. There's so much information out there on the internet that people can be misguided, and lots of supplements being sold and things that people can be misled. So we really encourage people to come see the experts, which is a great way to kind of understand their own body's needs and the science behind the nutrition.
Absolutely, there really is a science too. Should you be eating a protein with a carbohydrate? Should you, all that sort of stuff. What should you be eating together? Because some people think salad.
Exactly.
But you need your protein, you need your carbohydrates,
The
you need
balance
everything. It's the
is key.
balance.
Yeah.
That's right. And moderation.
Absolutely.
Yes. And
And
treats can
moderation.
fit. So
Yes.
we always say that, because if you're going to eat salad and chicken all the time, you're going to get so tired of it, and it's going to be hard to stick to. We can keep those really strict changes up only for so long, and then it's important to understand food is also part of our enjoyment of life, and letting
Absolutely.
us have those little treats in moderation can really help us enjoy life and stick to a plan easier.
That's
So.
right. Yeah, and I think treats have got to stay as treats too, not a
Ex-
daily,
Exactly.
every couple of hours. I'm going to have a treat.
That's
I'm going to have a
right.
treat. I'm going to buy the small chocolate bars because they're treats.
We really try to promote just balance overall, like
Yes.
Chandra was saying, and not making food stressful, because we all have to eat 3 times a day. We don't want people to be stressed.
Absolutely. And there's some people that they wake up thinking about food, and
Absolutely.
and when we do, they got to think properly, I guess. Yeah. Now, for more information, how do people get a hold of you?
They can just call. You can go to the website, Rideau Community Health Services. They have all the different sites and the phone numbers. They can phone and just simply request an appointment. I think that's
Okay,
probably
and
the
Yeah,
best.
you
that's
as well in that
Yeah,
area.
same. So we kind of have a central reception, and they'll guide you to if you're supposed to, connect with the Brockville office, Smiths Falls office. So just calling our main number, and they'll get you set up with that if you want to do a self-referral or just speak to someone. Yeah.
Okay, and you both are certified diabetes educators too. Is that just something like you were both interested in that and you went a little bit further in your education? Is that how that
Yeah, during my internship, I just fell in love with diabetes. I know it sounds weird, but I just loved diabetes and helping patients in that way. So yeah, decided to write the exam and yeah.
Yeah, yourself?
Well, I worked in the Brockville Hospital before I became a
Okay.
diabetes educator, and it was seeing all the complications of diabetes, seeing the people having heart attacks, strokes, kidney failure, you know, amputation, seeing all of that and thinking, okay, how can I help these people better? So that's sort
Before
of
it gets to that.
exactly before it gets to that point. So that's why I kind of grew to be interested in writing my CDE exam and helping people before that happens.
Yeah, and it's like you say, you have to keep up with that certification. There's things change all the time. We're learning
Exactly.
more.
Yeah. Very rapidly in the diabetes world, things are really changing.
Absolutely, absolutely. And hopefully for the better,
Yeah.
we're learning more.
Yes.
Absolutely. Good. Well, thank you very much for coming today and talking to us and bringing more awareness to March being Nutrition Month, but every day should be nutrition awareness. Wake up and what am I going to eat today? And Saturday's my treat day, maybe, you know, that sort of thing. But I like the fact that you can be self-referred. You can go in and just talk to you. It doesn't have to be through a doctor. You can just call and ask for Ashley or Chandra. Chandra.
And we have the rest of our team as well, so we're a whole team.
And how many of you are there?
Oh gosh.
I think there's about 4 diabetes dietitians, right?
Yeah,
And then there's 2 community dietitians.
Wow, the need is there, right?
Yeah.
That's
So
true, that's for sure.
That's what I'm saying. It's a huge program that people should take advantage of.
Absolutely, absolutely. Even just basic awareness.
Yep.
Basic awareness, you know? Yeah, wonderful. I mean, we all think we've been eating healthy for our whole life, and then we get to a point, it's like, man, I'm feeling the pounds coming on, I'm feeling, you know, we change too, you know? So maybe it's time to look at that. So.
Yeah.
Absolutely.
Excellent. Well, thank you very much for coming today and telling us more about March being Nutrition Month and everything that's going on at the Rideau Community Health Services in terms of dietitians. Thank you very much for joining us, ladies.
Thanks for having us.